Hello everyone, and welcome back to our channel. Today, we will explore 10 daily habits that can help slow down the progression of complications related to diabetes. Diabetes is a chronic condition that occurs when the body cannot produce enough insulin or use insulin effectively. This leads to high blood sugar levels, causing several serious health issues. If not well managed, diabetes can lead to dangerous complications such as cardiovascular disease, increased risk of angina, stroke, and heart attack. Kidney disease, kidney failure may occur due to damage to the blood vessels in the kidneys. Eye disease, diabetic retinopathy can cause severe vision loss. Nerve damage can result in pain, numbness, and loss of sensation in the hands and feet. However, managing diabetes is not only about medication but also requires healthy daily habits. By maintaining a balanced diet, exercising regularly, monitoring your health regularly, and managing stress, we can reduce the risk of complications and improve our quality of life. In today's video, we will share simple yet effective habits to help you slow down the progression of diabetes complications and protect your health. Let's get started. 1. Controlling blood sugar levels. Controlling blood sugar levels is crucial in managing diabetes and preventing complications. Patients should regularly check their blood sugar with a personal monitor at various times of the day and maintain levels within the target range, typically 80 to 130 mg/dl before meals and below 180 mg per deciliter after meals. Additionally, the HbA1c test is important as it measures the average blood sugar levels over 2 to 3 months and should be kept below 7%. Depending on medical guidance. Taking prescribed medications and insulin as directed is essential, with oral medications like metformin or insulin helping to manage blood sugar. Patients should also pay attention to their diet, including controlling carbohydrate intake, prioritizing high-fiber foods like vegetables and whole grains, and choosing healthy protein and fat sources from fish, chicken, beans, olive oil, and nuts. Limiting the intake of added sugars and saturated fats is also crucial to maintaining stable blood sugar levels and avoiding complications. The combination of medical monitoring, medication, and a balanced diet will help patients effectively manage diabetes and improve their quality of life. 2. Foot care. Foot care is an important aspect of diabetes management because people with diabetes are at higher risk of nerve damage and circulation problems, which can lead to complications in the feet. Patients should check their feet daily to detect any early signs of abnormalities such as ulcers, cuts, blisters, redness, swelling, or any changes in the skin. Keeping feet clean is also crucial, including washing them with warm water and mild soap, drying thoroughly, and using moisturizer to keep the skin soft. Toenails should be trimmed straight across and not too short to avoid ingrown toenails. Additionally, it is important to choose proper shoes and socks to protect the feet, ensuring that shoes fit well and do not cause pressure or rubbing. These measures help reduce the risk of serious complications, protect foot health, and improve the quality of life. 3. Controlling blood pressure. Patients should regularly monitor their blood pressure, using a home device to track readings, aiming for an ideal blood pressure typically below 120/80 mmHg. Additionally, checking cholesterol levels through a lipid panel test is essential, including measurements of LDL, bad cholesterol, HDL, good cholesterol, and triglycerides. The goals are to keep LDL levels below 100 mg per deciliter, HDL levels above 40 mg per deciliter for men and 50 mg per deciliter for women, and triglycerides below 150 mg per deciliter. Patients need to adopt a healthy lifestyle, including a diet low in saturated fats and high in fiber from vegetables, fruits, and whole grains. If necessary, doctors may prescribe medications to lower blood pressure and cholesterol, such as antihypertensives, ACE inhibitors, beta blockers, and statins. It is important to maintain regular health checkups and discuss health status and treatment plans with a doctor to adjust management strategies effectively and ensure the overall health and quality of life for people with diabetes. Don't forget to subscribe to our channel to quickly update the best health information. 4. Maintaining a healthy weight. Maintaining a healthy weight is an important part of managing diabetes and reducing the risk of related complications. When losing weight, especially in those who are overweight or obese, the body's sensitivity to insulin improves, helping to control blood sugar levels more effectively. This not only reduces the risk of complications such as cardiovascular disease, kidney disease, and neuropathy, but also improves overall health. To achieve and maintain a healthy weight, a balanced diet is essential. This diet should include plenty of green vegetables, fruits, whole grains, and lean protein sources such as skinless chicken, fish, beans, and soy products. Limiting the intake of high-calorie foods with low nutritional value, such as fast food, sugary drinks, and fried foods, is also very important. This eating plan not only helps control calorie intake but also provides all the necessary nutrients for the body. 5. Regular physical activity. Engaging in regular physical activity is essential for managing diabetes and improving overall health. Physical activity helps the body use insulin more effectively, regulating blood sugar levels and increasing insulin sensitivity. When exercising, muscles use glucose for energy, which helps lower blood sugar levels. This supports better blood sugar control and reduces the risk of complications such as cardiovascular disease. Exercise also aids in weight loss, maintaining a healthy weight, and improving mental health by reducing stress and boosting mood. Patients should exercise at least 150 minutes per week, engaging in activities such as walking, swimming, cycling, or running to enhance cardiovascular health. Additionally, incorporating strength training exercises like weightlifting or resistance bands can help build muscle mass. Flexibility exercises like yoga or stretching are also important for maintaining flexibility and reducing injury risk. 6. Avoiding smoking. Refraining from smoking is essential for maintaining good health, particularly for people with diabetes. Smoking causes numerous harmful effects, including an increased risk of cardiovascular complications such as coronary artery disease, heart attacks, and strokes, due to chemicals in tobacco that constrict blood vessels and raise blood pressure. Quitting smoking helps improve blood circulation and reduce the risk of heart diseases, as well as enhances blood sugar control by increasing insulin sensitivity. Additionally, quitting smoking lowers the risk of kidney disease and other diabetes-related complications, improves lung and respiratory health, and extends life expectancy. To quit smoking, one can use nicotine replacement therapies like patches, gum, or lozenges, or take medications to reduce cravings. Participating in counseling programs or support groups can also provide motivation and strategies for quitting. Learning stress management techniques such as meditation, yoga, or physical activities can be beneficial. 7. Oral care. Oral care is an important aspect of overall health management, especially for people with diabetes, as they are at higher risk of developing issues like periodontal disease, cavities, and oral infections. High blood sugar levels can reduce blood circulation and weaken the body's ability to fight bacteria, making the gums and surrounding tissues more vulnerable. Proper oral care includes brushing teeth at least twice a day with fluoride toothpaste, using dental floss daily, and having regular dental checkups at least every 6 months. Adjusting the diet to limit sugary foods, maintaining good blood sugar control, and using appropriate oral care products are also crucial for maintaining oral health. Avoiding harmful habits like smoking further helps reduce the risk of periodontal disease and other oral issues. 8. Managing stress. Managing stress is a crucial factor in maintaining overall health and controlling diabetes, as prolonged stress can decrease insulin sensitivity, making it difficult to manage blood sugar levels. Meditation, an effective relaxation technique, helps calm the mind, improve concentration, and bring a sense of peace. Regular meditation practice can lower heart rate and blood pressure, contributing to overall health maintenance. Yoga, combining physical movements, breathing, and meditation, not only reduces stress but also improves flexibility and muscle strength, regulates the nervous system, and reduces anxiety symptoms. Exercise is an excellent method for releasing endorphins, which create feelings of happiness and reduce stress, while also improving sleep and cardiovascular health. Gentle forms of exercise such as walking, swimming, cycling, or aerobics are ideal choices for beginners. Incorporating deep breathing techniques into your daily routine can also help alleviate stress instantly by activating the body's relaxation response. 9. Education and health counseling. Education and health counseling are crucial in managing diabetes, helping patients better understand the disease and how to control it. Understanding diabetes, including its causes, symptoms, and potential complications, allows patients to manage the condition more effectively and make confident health-related decisions. Additionally, knowledge about the disease helps prevent complications and improves the quality of life by encouraging lifestyle adjustments, a balanced diet, physical activity, and stress management. Patients can attend diabetes education classes organized by healthcare professionals to gain basic and advanced knowledge. Personal counseling with doctors, dietitians, and psychologists is also important, providing personalized treatment plans and support for applying knowledge in real life. Furthermore, patients can use self-study materials from books, reputable websites, and mobile apps to monitor blood sugar levels and manage the disease effectively. 10. Regular health checkups. Diabetes can lead to many serious complications if not monitored and controlled promptly. Regular health checkups help detect early health issues and intervene before they become severe. Important types of regular health checks include eye examinations, kidney function tests, cardiovascular assessments, and foot inspections. This prevents diabetic retinopathy and vision loss. A vision test assesses overall visual acuity. Kidney function tests include urinalysis to detect protein levels in the urine. Additionally, kidney function tests measure creatinine levels and glomerular filtration rate, GFR, to evaluate kidney performance. For cardiovascular assessments, blood pressure monitoring helps track and manage hypertension. Cholesterol tests measure total cholesterol, LDL, bad cholesterol, and HDL, good cholesterol, to manage heart disease risk. Foot inspections help identify issues like ulcers and infections due to nerve and circulation damage in the feet. Lastly, general health checks include blood glucose testing to adjust treatment. Monitoring weight and body mass index, BMI, helps adjust diet and physical activity as needed. 5 foods that are beneficial for individuals with diabetes. Berries, strawberries, blackberries, blueberries, raspberries. Berries are rich in antioxidants, vitamin C, and fiber. They have a low glycemic index, which helps better control blood sugar levels. The fiber in berries slows down the absorption of sugar into the bloodstream. Strawberries and blackberries contain anthocyanins, which may help improve insulin sensitivity. Blueberries provide essential vitamins and minerals like vitamin C, vitamin K, and manganese. Raspberries have a high fiber content and are low in calories. Chia seeds. Chia seeds are a source of omega-3 fatty acids, fiber, and plant-based protein. They have a low glycemic index and help stabilize blood sugar levels. The omega-3s in chia seeds are beneficial for heart health and can reduce inflammation. The soluble fiber in chia seeds helps regulate blood sugar levels and supports digestion. Fatty fish, salmon, mackerel, sardines. Fatty fish are rich in omega-3 fatty acids and protein. They are good for heart health and can improve insulin sensitivity. Omega-3s help reduce inflammation and support cardiovascular health. This can potentially lower the risk of heart disease in people with diabetes. The protein in fish also helps maintain a feeling of fullness and can aid in weight management. Leafy green vegetables, spinach, lettuce, kale. Leafy greens are packed with vitamins, minerals, and antioxidants. They have a low glycemic index and are very high in fiber. This helps to maintain stable blood sugar levels. Spinach and lettuce provide vitamins A, C, K, and folate, along with minerals like calcium and iron. Antioxidants in leafy greens help reduce oxidative stress and inflammation. Whole grains, oats, whole wheat, quinoa. Whole grains are high in fiber, vitamins, and minerals. They have a lower glycemic index compared to refined grains. They help control blood sugar levels and provide long-lasting energy. Oats contain beta-glucan, a type of soluble fiber that helps improve cholesterol levels and regulate blood sugar. Quinoa is a complete protein source and is rich in B vitamins, magnesium, and iron. These foods not only help in controlling blood sugar levels but also provide essential nutrients to maintain overall health and reduce the risk of diabetes-related complications. Thank you for watching our video on daily habits to help manage and slow down the complications of diabetes. By incorporating these simple yet effective habits into your daily routine, you can make a significant difference in your health and well-being. Remember, controlling diabetes is a continuous journey that involves a balanced diet, regular exercise, consistent health monitoring, and effective stress management. Stay proactive, stay informed, and keep striving for a healthier lifestyle. If you found this video helpful, don't forget to like, share, and subscribe for more content on managing diabetes and improving overall health. Feel free to leave any questions or comments below, and we'll see you in the next video. Take care and stay healthy.